Good morning, everyone, and welcome to the County Seat. I'm Terry Wood. Today we're taking a look at a topic that's a bit different than the stories we sometimes cover. Here's the background. A couple of years ago, Salt Lake County took a bold step, and it stirred up a bit of a hornet's nest at the same time because it took direct funding away from Valley Mental Health and turned the entire budget over to a private contractor. The contractor promised to save money in the long run and provide a higher level of service in the area of mental health. Well, now, 2 years later, we'll take a look back and see what the contractor did and if it delivered on its promises. Chad Booth has our story.
911, what is your emergency?
I need some help. My husband got home from work this morning. He was really upset. He's locked himself in the bathroom and he said he's going to kill himself.
What would you do when you or a loved one faces a crisis situation? What is the appropriate response? For many of us, the first thing we would think is to call 911.
And that has always generated a police response. And then the police say, well, we're not sure what to do, so let's send them to the emergency room for their safety. And then they would go through both a physical and a mental health evaluation in the emergency room.
That is changing with the emergence of mobile crisis outreach teams who provide a new tool to help people in crisis.
Now we can just go out and do the mental health evaluation on site in their own home. We can avoid ambulances, we can avoid fire engines, we can avoid police in many cases. That can create quite a disturbance in the community.
Okay, you can tell the mother we'll be there in 30 minutes to help her and her son figure things out, and if you think it's safe to clear the scene, we'll contact you if we need more assistance.
In Salt Lake City especially, we're considered just a third piece of the emergency response system. You know, police are called out for safety issues, EMS and fire are called out for medical concerns, and the mobile crisis team is called out for mental health and behavioral health issues.
Crisis services that are available include a hotline that's running 24 hours a day, 7 days a week, mobile crisis outreach teams, a receiving center, a safe haven for people to be housed short-term, and even some longer-term solutions for people struggling with any number of psychological problems. All of these tools together provide a better solution to handling mental and behavioral health issues, which in the past normally were dealt with through jail time or emergency room visits or just pretending the problem didn't exist.
We think this is just the current situation probably, so we can go in and talk with them now.
All right, I'll take you guys in.
The ability to handle crisis situations at a person's home lessens the impact on the community as a whole, while costing the county and ultimately the taxpayer far less money in the long run.
Helping them talk through that situation and then figuring out a plan of how they're going to deal with that is frequently all that's needed. You know, they don't need to go to the ER necessarily to have someone walk through that situation and help them get the referrals and resources they need to handle those stressors. A lot of people are very reluctant to go to an emergency room, especially if they can't afford to do so or they don't have adequate insurance to cover that. They can call the crisis line, talk to a crisis line staff person at any time of day, and if necessary, then the crisis line staff can see if they're interested in having somebody come out and talk to them. And really what we're trained to do is to de-escalate situations immediately and then sort through the crisis piece itself and see if the person can be maintained in the community or whether they need some higher level of service.
By integrating mental and behavioral health services into a mix of emergency medical practices, the county and its partners are reducing costs of unnecessary emergency response, preventing hospitalizations, and getting people the help they need. When they all work together, it can be a big win for everyone involved. For the County Seat, I'm Chad Booth.
Thank you, Chad. And we'll be back in just a moment. We'll introduce our panel of guests and we'll have further insight into this new dynamic.
Along Interstate 70 and Highway 89 is an area that is rich with high mountain peaks, vast forests, lakes, streams, historical sites, and a climate that is perfect for outdoor adventures, no matter what the season. You will be greeted by local residents with a smile and a welcoming hand. in the center of it all, Sevier County.
June 27th to the 29th, Morgan Valley Polaris presents the Widowmaker Hill Climb in Croydon, Utah. The world-renowned gravity-defying event is back, and this year it's bigger than ever. See our international racers pit themselves against the mountain, and for the first time ever, racers will drag race up the Widowmaker Hill to prove their superiority. The first 50 campers will receive family 4-packs to Rocky Mountain Raceway, provided by Young Ford and Morgan. For discount tickets and more info, check out www.widowmaker.info.
Kanab, base camp for your southern Utah adventures. You belong in Kanab.
If you haven't been to Starvation in a while, you're in for a great surprise. New campsites, new cabins, and beach improvements await your next visit. Just 3 hours away, but a world away from the Wasatch Front in Duchesne County. Starvation State Park is located 4 miles northwest of Duchesne, just off US Highway 40. Duchesne County. Close enough for business, far enough to get away.
Welcome back, everyone. Let's introduce our distinguished panel of experts today to talk about this rather interesting subject. On the far end of the table, Kelly Colopy. She's the contractor for Salt Lake County Mental Health Services. Barry Rose is with UNI, that's the University Neuropsychiatric Institute. He's the Crisis Services Manager. We have a lot of acronyms today. We'll use them, but I'll explain them here at first. UNI is University Neuropsychiatric Institute. Ron Bruno is with the Salt Lake City Police Department, but he is actually the Crisis Intervention Team Program Director for the state of Utah. Those are the CIT services. And Jeannie Nelson is the Health Policy Coordinator with Salt Lake County. Jeannie, let's start with you. How has this program benefited Salt Lake County over the past couple of years as opposed to what was going on before?
Oh, it's benefited immensely, both families and community. As you probably know, counties are the local authorities for both mental health and substance use disorder services. What we try to do at Salt Lake County is keep the governmental layer very thin, so we don't provide direct services ourselves for those services. Instead, we try to push all of that funding out to private providers within the community. Optum Health is our managed care organization who manages both our Medicaid and non-Medicaid mental health services for that, and also our substance use disorder in the Medicaid side. And they came in through a competitive bid process. And then Barry and his programs also would be a competitive bid process that came in at UNI through Optum. And so that's kind of how it all came together.
So Kelly, as the private contractor, then what do you do? How have you changed these services as they were previously when Salt Lake County was running the services?
Well, Optum came in 2011, and one of the things that we've really been working on is building on a network of services. So my role is to build out a network of services that sort of meet the needs of people at all different levels. And our real focus is around that people can recover. And so we've really been working on different services that give people hope and that they can work towards a recovery process. And the crisis programs that we were able to bring to Salt Lake County help to do that. There's a warm line where a peer support person, someone who's been through mental health, can call and to talk with people, and we can work with people in their communities instead of in hospitals and emergency rooms, so that people feel greater support and don't feel like they're always in a crisis mode.
And talking with people in their communities, that's something that you're pretty much in charge of, isn't it, Ron? For the entire state, actually. Explain what you do and how it works right down on the personal level.
You bet. The CIT program, Crisis Intervention Team, basically has two main goals. The first one is to develop a cadre of CIT law enforcement officers in all law enforcement jurisdictions that learn how to deal better with people who have mental health issues. So the other goal, though, is to actually build a partnership between mental health services and law enforcement services.
Now, how does this partnership work specifically? What happens when you get a call with someone who is perhaps mentally disturbed?
What this new system does is it basically brings mental health services right up to the person who's having the crisis in the community. So for example, now when a law enforcement officer goes out, they can actually call UNI through the 24-hour crisis line and ask for MCOT, the Mobile Crisis Outreach Team, to come out and help with that situation. The Mobile Crisis Outreach Team is made up of a designated examiner, mental health professional, as well as a certified peer specialist. Once they get on scene, many times they can actually release that officer from the scene and let the officer go back into the community to handle other calls for service. That's a big benefit, both cost-saving wise as well as allowing the person that needs mental health care to truly get mental health care.
And in the past, those folks, they would have called the police, and they would have had no choice usually but to take them to an emergency room. They would have sat in an emergency room maybe for hours waiting to be seen because they're not a high priority in terms of somebody that's coming in bleeding, and rightly so. We're able to now be out there on scene and take care of the situation. And if those people do need a higher level of care, then we look to our other programs first, our receiving center, where people can go and they can get medication management, they can talk to a peer specialist, they can sit and just talk and just be in a safe, supportive environment for a time to kind of settle things down. And what we find out is most people that are in crisis really just need time and the right kind of support to kind of get their balance back. And the receiving center does a wonderful job of that. They're admitting 50 or 60 people, I think, over the last week and a half. And of those people, maybe 2 or 3 end up having to go into the hospital. Most of them get referred back out to outpatient services.
How often does someone end up in UNI or other hospitalized services under this mobile crisis intervention team?
Well, specifically the mobile team, we're going out into the community on averaging around 200 outreaches a month right now.
200 a month?
200. And of those, about 10% end up being hospitalized. So the success rate is tremendous. We're going out into the community, we're meeting people where they are, we're providing the kind of services, either crisis intervention type services, or referrals, we do follow-up calls, we help people get the proper services at the right time, and it's an amazing program. I mean, families love it. They're able to now call and get, and about 75% of the time we're not involving law enforcement or fire departments or anyone else. They go out on their own, they meet with families and individuals and solve the situation and create follow-ups and leave them at home.
How many teams do you have? I mean, 200 a month, that's an awful lot of calls. You must be quite busy.
We have actually 3 teams on duty all the time. We have a team, a north team at UNI, and we have a south team at our Daybreak facility, a hospital, South Jordan Medical Center, and we have a youth team that's stationed at UNI right now, and they go all over the county.
And some of these people who are helping deal with the problem are, you call them peer groups, people who have been through the situation before themselves?
Peer support. And so peer support workers are people who have dealt with mental illness in their own lives, and they've really been able to address those issues for themselves and are much more successful in their communities. And they've come back to work with our organizations to help support others. And so they go out as part of the MCOT team with a mental health worker and help to sort of stabilize the situation and help people see that yes, you can get better, that you can recover. And so their big message, and they're at the receiving center as well as on the warm line, is to show people that yes, it's this is tough right now, but there's hope for you, and that there is a recovery process. And so it's a real statement, and I think it's really comforting for those who are in the middle of a crisis.
It must be easier for the so-called victim to relate to the peers.
That's what we found.
We use peer specialists in teams in all our programs, and they just bring an extra element of that connection that others can't. Clinician like myself can't do, and a lot of the folks, when we go out on somebody that's suicidal or something and they're feeling hopeless, the peer specialist can step in and say, "I've been there. I've been through that. I know you can make it through this. This is what's available. Let us help you," and it's very powerful.
Plus, also the certified peer specialists become certified through training with the state of Utah. So they do actually receive specialized training and become certified peer specialists.
And as you mentioned, this is probably a big benefit to families, and I'm sure there'll be some family members watching this program this morning that are thinking, you know, there's a possibility I may need some of that help, that intervention. So we're going to take a break here, and we're going to come back in just a few minutes. You're going to find out exactly how you can get the help from these crisis intervention teams and how it can benefit you. We'll be right back.
Let's be honest, you don't know much about Beaver County. Well, let me tell you about it. It's the birthplace of outlaw Butch Cassidy and inventor Philo T. Farnsworth. Some of the best skiing in Utah is at Eagle Point. You've got camping, Canyon Breeze Golf Course, Crusher and the Tushers, Beaver Territorial Courthouse, snowmobiling, renewable energy, Pioneer Car Show, Squeaky Cheese, Ghost Towns to explore, best water in the country, Paiute ATV trails, Old Frisco kilns, horse racing, hunting, fishing, and it's a good place to live. Beaver County, mountains of fun. I could tell you more, but why don't you come and see it for yourself?
So, what brings you to town?
What brings anyone to St. George? A couple rounds of golf, a little relaxation.
What is that all?
Is there more? In a retirement community? Should have stuck with the back nine.
Believe it or not, summer isn't far away, and neither is Juab County. There's no need to travel far to find the perfect family adventure. Boating Yuba Reservoir, exploring Mount Nebo, riding Little Sahara. Save your gas this summer and stay in your own backyard. Juab County. It'll change your family forever.
Welcome back, everyone. We're talking about crisis intervention management, mental health issues here in the Salt Lake Valley specifically, and the new model that the county is using to deal with these issues, along with private partnership and several other agencies. And the crisis teams go out and assess a situation, then decide where the best place to go is. This has got to save a lot of money, especially in incarceration, doesn't it?
It does. A specific example to kind of wrap your mind around it. One of the gentlemen in our system, he was booked 52 times. He served 1,600 days in jail, and he's only 30 years old.
You're kidding.
And had serious mental illness. And it's the type of case where the arrest situation happens because of his mental illness. He's not a risk to himself or others. It's the kind of person that you would like to divert from the criminal justice system. What we know is that a year in jail is about $30,000 a year or more, and a hospital setting is about $1,000 a day. So diverting these individuals from either of those higher levels of care is very cost-effective and fiscally responsible, not to mention it's a real quality of life issue for the person as well.
Say someone's watching this program now and they have a family member they're concerned about too. What would they do? How would they go about contacting your team? Where would they get help?
587-3000.
587-3000.
801.
That's just area code 801.
Yes. And anyone that can, if you can remember that number, you can get any of our services, and you can get a licensed clinician to talk to on, if you're in crisis, just via the phone, or the mobile team can be called out, or people can get referred to the receiving center or our wellness recovery center. Any of the, as long as people can remember that one number, they can get all these services.
587-3000.
Right.
Yes. And now, of course, if there is a situation where there's an immediate danger, then of course they should contact 911. But when they do, they should ask for a CIT officer, somebody who has actually been specially trained to deal with mental health issues.
Ask for a CIT officer. That's
Yes.
the crisis intervention team.
Officer.
And this is bound to have changed the way the public is also looking at mental health issues, isn't it?
Absolutely.
I hope so.
Yeah, I mean, it does address stigma. I mean, and that's kind of what a lot of the crisis services do, is it's making it so it's not this big production anytime somebody goes into crisis. It's basically trying to handle the situation as low-key and with as much sensitivity as we can possibly do.
And we're getting it sophisticated enough to where we're even involving dispatch now.
Absolutely.
Ron's really been instrumental in getting even dispatch. If somebody calls the dispatch line or calls 911 and they're just feeling suicidal, they patch them into our crisis line. And we do a screening with the dispatcher. And oftentimes they can just give that call to us. We can send our mobile team or just talk to them on the phone. And it saves overuse of all those services and people having fire engines show up at their door unnecessarily.
So dispatchers are being trained to recognize these issues too.
As well.
Absolutely.
So, you know, when we think about this, the whole system is participating together. And so, you know, the fact that law enforcement is directly connected to UNI and the crisis line and all the different programs, and then once they come into MCOT, they can immediately be attached to other services that they need. And so there's not a time when they're feeling alone. They are connected as soon as they can be connected, and that's the part of the system that hasn't been in place in the past. And what we've found is through this process, just over the last 9 months, we've saved about $2 million in healthcare costs, meaning
in the last 9 months.
In the last 9 months, so
and
since
would those
last
be
July.
county dollars? You say Salt Lake County $2 million?
Yeah, so well, part of it is through resources that would otherwise go to an inpatient stay or a psychiatric hospital stay, which are very expensive if you stay for very long, and then also the ER costs. So the ER costs are more to healthcare overall than they are to the county. But all of those resources then become available to be able to serve more people in the community. And so by putting all these programs in place, it's really been an opportunity to include more people in the services that are out there and to support them.
And also that doesn't include the expense of law enforcement, emergency medical services to roll out.
Oh, yeah.
That's right. So it's a huge
and if a person is placed in a hospitalization situation under one of your teams, are they still responsible for that bill that comes from the hospital, that cost, or is it covered through some of these programs?
Well, if they're Medicaid, then they are covered. And so if they go in and they're Medicaid, then they're covered. If they have other insurance, the other insurance will cover it for them generally. And there are some resources available for those who don't have any insurance.
And also MCOT, Mobile Crisis Outreach Team, the Receiving Center, those are no-cost services.
Right, that's important for people to know. Yeah. These are all no-cost services to individuals.
Do you cover homeless people as well? Do you get calls for the homeless areas?
Absolutely. When you take in consideration a large percentage of the population of the homeless have a serious and persistent mental illness. I mean, after all, that's why they are homeless, is they're not able to deal with life. So yes, we do come into contact with that, and again, getting the resources to that individual in the community is a lot easier than trying to get somebody homeless saddled up and put into the back of an ambulance and dragged against their will to an ER.
We'll be right back.
Rediscover your sense of adventure. Welcome to San Juan County. Discover the past. A change of place. Utah's San Juan County, where life is elevated.
You go through the day-to-day repeating what you did yesterday. Don't you wish you could access that piece of your life that's missing? Find the beauty, serenity, family fun, or anything else that's missing from your life in the Cedar City, Bryan Head area. Gain access to your adventure, whether it's camping, hiking, the arts, festivals, or just a getaway. Visit ScenicSouthernUtah.com for details on all the adventures that you can access in scenic Southern Utah.
Unlimited opportunity for adventure. It's all about knowing where to look. ATV adventures, rock crawling events, art festivals, and wildlife events. The opportunities are limitless. Pick your adventure in Millard County.
Welcome back, everyone. We're continuing to discuss the crisis intervention response teams, the way the county, Salt Lake County specifically, has been dealing with these issues in the past couple of years. It's a new model. Ron, you are in charge of a crisis intervention team that is a statewide team, correct?
Yes.
Is this spread to some of the other communities? Although we've talked a lot about Salt Lake County. Has it gone to other counties and rural areas of Utah too?
It's starting to. So the CIT program that I'm in charge of, we basically have partnerships between law enforcement and mental health services in 8 of the 11 mental health centers. So during our meetings with the regional coordinators, they learn about our services here, and then I encourage them to actually duplicate. And some of them have started.
Now, I've heard in the past from Sheriff Winder that a problem like this occurs. They incarcerate someone, they can give them medication to get them back to a stable emotional well-being, but once they're back to that level of stability, they've got to release that person and then they don't take their meds once they get out again. Is this still a problem, or have you managed to solve that?
Well, there is a program that Valley Mental Health is running where they meet at the jail, and they, as someone comes out of the jail, and connect them. They drive them to a treatment place, and so they actually are connecting them to additional services, and they're connecting them to additional medication, which is another part of this whole process. So we've been talking about these crisis services, but there also is this whole other piece of alternatives to incarceration, different ways that we support people coming out of the jail or helping them not get to jail first, that the county has been working on for a long time.
So as we said at the beginning of the program, the county took a bold step in making this move a couple of years ago. How does the county feel about it now, Judy?
We're incredibly excited. I feel very lucky to work for the county. There's some very forward-thinking leadership there. From our mayor to our county council, they really recognize the benefits of these programs. You know, if you or I had a mental health crisis, we would want to be in the least restrictive setting. I'd want to be able to stay in my home, and if you can do that and also provide a cost savings to our taxpayers, it's wonderful. So we feel very lucky to have such talented folks and such wonderful programs to do this with. So
does sound like a win-win situation all the way around.
Yes.
Well, let's once again reiterate that number. If you or a family member you think could use these services that you've heard about on this program today in a crisis intervention mode, 801-587-3000. And that's right direct to the MCUT team, 24/7. And you can get help in your own home without a great deal of, as you put it, stigma with police and fire trucks arriving at the same time. Help from people who've been through the same situation. 587-3000. But if it's an emergency, don't forget to call 911. I'm Terry Wood. Thank you for joining us on the County Seat today. We'll see you next Sunday morning.